What is a Jackson-Pratt drain? A JP drain is a bulb-shaped device connected to a tube. One end of the tube is placed inside of a patient surgically, and the other end comes out through a small opening in your skin. You may have a stitch or two to hold the tube in place. As you can see, this is a picture of a JP drain. It has the tube coming out of a small hole by the sutures, and then the bulb at the end. The bulb is flat because the drain works by creating a suction within the tube itself. The bulb is squeezed flat, like in the picture, connected to the tube outside of the body, and expands as it's filling with fluid. Some JP drains may have a bandage around the drain site, and it needs to be changed at least once a day, and more if it gets completely wet. The steps include 1. Washing your hands with soap and water, 2. Loosening the tape and gently removing the old bandage, and then throwing it away. 3. Use soap and water or a saline solution to clean the drain site gently. 4. Pat the area dry. 5. Place a new clean bandage on the skin. Tape it down with medical tape. And 6. Wash your hands. Enjoy this demonstration of how to empty a JP drain.
Okay. In this brief video, we will see how to empty a closed suction drain, such as a Jackson-Pratt drain, and measure the output. Holding the bulb upright, we uncapped the port. Turning the bulb over, we empty it into the container. We squeeze the bulb to evacuate the container. Keeping the bulb squeezed, we recap the port. Then we measure the fluid. We measure it in milliliters, cubic centimeters, or fluid ounces. Your doctor or nurse will know how to convert these units. The important thing is that we know the drain output for a given 24-hour period in whatever units you are comfortable measuring.
It is important to contact your physician if a couple of things happen with your drain. One is if the drainage is less than 30 milliliters of fluid within 24 hours. That means that your drain might be able to come out. If suddenly you stop having any drainage at all, or think that your tube is blocked, it is also important to contact your physician. If you have a fever higher than 101.5 degrees Fahrenheit and have increased pain, redness, or swelling around the drainage site, it is important to contact them. If you have questions about your JP drain, you can contact your nurse or your physician, and they should be able to answer any questions. Here's another example of what a JP drain looks like. Also, here's a picture of a woman with 2 JP drains.